Waiting in the ER, wondering why it's taking so long? In this video, I will describe the various reasons why it takes so long to be seen by a physician in the ER and what happens behind the scenes. I've experienced the ER as both a patient and as a physician, and I wanted to give people a general overview on why it can sometimes take 6 to 8 hours in the ER to be seen and or get treatment. The reason you wait so long to be seen in the ER is primarily due to a number of limiting factors. Like the world around us, resources are finite, meaning we have to know how to ration the resource that we have to help the greatest amount of people. In the ER, the primary finite resource is time. Next is personnel, such as physicians, nurses, and/or support staff, and of course space, such as beds. One of the primary determinants on how fast you're seen in the ER is how you get to the ER. Generally, if you come to the ER via an ambulance, you will be spending less time waiting to see a physician. If you walk in or drive yourself to the ER, you'll usually be waiting a longer time to be seen and or get treatment. But this is not the case if you're experiencing an emergency, in which case you will get immediate treatment. But who makes these decisions on who is experiencing a true emergency and who can wait? The answer to this is the triage nurse. The triage nurse is the nurse that takes the history, which means that this nurse asks the questions what, why, where, and when type of questions. Next, the triage nurse takes your vitals, such as your blood pressure, heart rate, breathing rate, temperature, and pain. Finally, if per their history, the triage nurse can also take a quick EKG to check for any heart abnormalities. After understanding the patient's issues, the triage nurse then decides who gets a bed and generally in what order. Of course, if the patient is experiencing a true emergency, they are seen first, even if other patients have been waiting hours before. True emergencies are situations where time is short and a lack of treatment can lead to permanent injury and or death. Examples of this are heart attacks, strokes, and or massive trauma. Once the patient has been processed by the triage nurse, that information is then relayed to the ER attending, who is basically the lead ER physician. This can be done either in person, or the triage nurse can inform the ER attending via their computer terminal. Time-critical emergencies are of course discussed in person. Once the ER attending has been made aware of the new patient, they then themselves take a history and physical to better understand the patient's emergent needs. They then order immediate treatment options such as oxygen and or medicines that can be given to the patient for immediate relief, for stabilization, for any immediate needs of the patient. The attending physician can also send out for labs if need be, and the ER attending can send out for any imaging studies if need be. Regarding labs, the ER attending usually orders labs via their computer terminal to the nurse. The nurse then notices these labs, which the attending physician wants, and gets the appropriate vials to draw the labs. Once the labs have been drawn, they need to be sent to the main hospital lab to be processed. Once processed, these results are then sent back to the ER attending for review. Regarding imaging studies, the physician usually orders imaging studies such as X-rays or CTs via his computer terminal. The patient is then transported to another room for the appropriate imaging studies such as X-rays. Once the imaging studies have been completed, the patient is then transported back to his room. Once the ER attending has most of the information that he or she has requested, they then review the results of their history, physical, drawn labs, and or imaging studies. They then decide to either admit the patient to the various departments of the hospital, or they send the patient home with a prescription for further treatment and follow up with a regular physician.